What does lipedema recovery really look like? For how long should you wear that compression garment? And when can you finally take a shower? In this video, you're gonna find out. Hi everyone, my name is Dr. Markelov. I'm a double board certified plastic surgeon. Lipedema liposuction is a serious procedure, and proper recovery is essential for achieving the best possible result and minimizing complications. It's not a quick fix, and understanding the healing journey is the key to a successful outcome. Importantly, the recovery process starts immediately after the procedure. In fact, we encourage early walking as it significantly speeds up the recovery process. There is really nothing to hurt by doing too much, within a reasonable limit of course. Walking helps to activate the lymphatic system in your legs, which is essentially a pump that helps to drain excess fluid and reduce the swelling. This early mobilization is key to a smoother and faster recovery. We use a tumescent liposuction technique, which allows us to perform the procedure while the patient is awake. This awake nature of the procedure streamlines the recovery and eliminates the risk of general anesthesia, and greatly reduces chances of life-threatening complications, such as deep vein thrombosis and pulmonary embolism. In fact, most of our patients walk from the operating table to the recovery area on their own feet. Immediately after the surgery, you'll experience some swelling and bruising and discomfort. This is perfectly normal. We utilize a rapid recovery protocol, which may include medications like celecoxib, Celebrex to help to reduce the swelling and pain, along with Tylenol. In some cases, we also prescribe a short course of narcotic pain medications to help you sleep comfortably in the first few nights, though the majority of our patients don't require them. You might also notice some numbness in the treated areas initially. This is due to the nerves being bruised, not really damaged or disrupted during the procedure. In the immediate postoperative period, it's also normal to feel tired and even dizzy at times, especially after getting up. You might even feel like you want to faint. This is a usual reaction as your body adjusts after the removal of the fat tissue. The dizziness can also occur when taking the compression garment off, so it's important to be next to a couch or bed or have someone by your side when changing or taking off the garment for the first couple of times. If this happens, you should lay down, drink plenty of fluid. I recommend replenishing electrolytes as well by adding electrolyte powder with your drink, or simply by adding a teaspoon of pink Himalayan salt that has all the electrolytes to your water. This helps with the transient volume deficiency that can occur after the surgery. We utilize a special protocol to minimize blood loss during our liposuction procedures. However, if the feeling of dizziness and fainting doesn't go away, you should let your doctor know immediately, as you might need to be evaluated in the nearest emergency room, check your blood work and vital signs. Compression garments. Compression garments are crucial for your recovery and should be worn as instructed. We will fit you with this immediately after the procedure. They help to reduce the swelling and support the treated areas. Some of the incisions will be left open to allow fluid drainage and to minimize the swelling. We don't use drains in our practice. Most of the leakage will stop within 4 to 5 days. Absorbent pads will be placed outside of the compression garment to catch the fluid. They can be changed as needed as they become saturated without taking the actual garment off. You're allowed to take a full shower and get your incisions wet within 48 hours after the procedure. Incision care is very easy. Simply wipe the incisions with the hydrogen peroxide and alcohol swab alcohol pad twice a day. There is no need to place dressings over the incisions, as this can leave an indent on the skin with the compression garment. You will need to continue wearing compression garment for 4 to 6 weeks after the procedure. There are different types of garments available, and later in the recovery process, you can switch to something like normal-looking leggings that provide some compression. In addition to compression, we often recommend incorporating lymphatic drainage massages into your recovery process. These specialized massages can be started as soon as a few days after the procedure. However, they can be painful initially, so the timing might depend on your ability to tolerate them and the experience of the massage therapist. These specialized massages can help to reduce the swelling, improve lymphatic circulation, and promote healing. You should look for a qualified therapist experienced in the post-liposuction care. If any type of oil or lotion is used during the massage, I don't recommend putting it over the incisions until they are fully healed. So now let's talk about minimizing bruising and optimizing scar healing. There are some anecdotal evidence that arnica gel or bromelain can help to minimize the bruising. If you decide to use it, don't put it over your incisions, and it should be used early in the post-operative period, within a few weeks of the surgery. For long-term scar management, the only thing that was actually proven to work by the studies and to prove scar formation is silicone. Once the incisions are fully healed, usually 4 to 6 weeks after the procedure, I recommend the application of silicone cream or gel twice a day to your scars. This helps to keep the scar hydrated and blocks the oxygen supply to the scar, which leads to better scar formation. I don't recommend silicone patches since they're hard to use under the compression garment. In general, you want to avoid exposing your incisions to direct sunlight, especially early after the surgery, and especially if you stop wearing the compression garment. Sunscreen is highly recommended. Some individuals may develop darker discoloration of the scar. This usually fades away over time. Hydroquinone cream can be used to lighten up the scar if desired, but consult with your doctor first. Although scarring is generally not a major concern for most patients, as the incisions are very small, about 2 millimeters. It's important to be patient, as the scar formation actually takes about a year. Here's a general timeline of what you can expect with your lipedema recovery. Same day, light walking, and it's actually encouraged right after the procedure. Next day, more walking, you still have a lot of bruising, swelling, and soreness. Day 3-4, you can resume activities around the house, grocery shopping. First week, focus on the mobility, walk is tolerated, hydration, high protein diet, and wound care. You'll have still some limitations on your mobility initially, and numbness in treated area can still be present. Week 2-4, swelling and bruising will start to subside. You can gradually increase the activity level, but still avoid strenuous exercise. As the nerves begin to heal, the sensation might change to a feeling of pins and needles or extreme itchiness in the area of the liposuction. This is basically a sign of nerve regeneration and a normal part of the healing process. Week 4-6, most patients return to all of the normal activities, and afterwards you continue healing. You might still have some swelling for up to several months. Beyond 6 weeks, while most activities are resumed, some swelling can still persist, especially below the knee area. This residual swelling will not preclude you from doing any activities, and you will still continue to see refinement of your results and more long-term results. I obviously recommend to continue to follow up with your surgeon. While blood loss during the majority of our liposuction procedures is minimal and very well tolerated by a healthy body, if you have low hemoglobin levels due to anemia, or if you undergo multiple stage procedures, I recommend taking iron supplements to boost your hemoglobin levels. A good natural alternative that can be purchased over the counter is a supplement called Blood Builder, but obviously ask your doctor what he would recommend. Everyone's recovery journey is unique, so it's important to listen to your body and be patient. Don't compare your progress to others. If you have any concerns, don't hesitate to contact our office. We are here to support you every step of the way. I hope you found this video helpful. Please click the like button and subscribe below.